In low and middle income countries, maternal deaths occur disproportionately following caesarean sections, and the huge variation in caesarean section rates demonstrates that decisions to deliver by caesarean are not always made wisely.
A lot of things that we've learned this week we only saw in books and actually didn't have the practical skills.
Sometimes inappropriate decisions and poor outcomes are made due to a lack of training and supervision, leading to the combination of too little too late and also too much too soon.
I've been in this school for several years, but I've learned so many things I've been taught so many things. In just 1 week, things I've never been taught before.
A number of times we just had to, go straight to the patient without having had that opportunity to practice, but this course has been really helpful in that aspect. As a young consultant, I've had the opportunity to gain deeper understanding about some of the procedures and have a practical demonstration on how to actually do the procedures, something that I may not have had a chance to do as a resident.
We want to make good decisions. So we want to have a systematic approach to making decisions for women about both when we deliver them and how we deliver them. The 5-day course by the Liverpool School of Tropical Medicine's Centre for Maternal and Newborn Health seeks to address this gap in training and improve quality of care.
Wonderful training, it could not have come at a better time. Now, unlike other courses that I've seen, this course is intensive because you learn something and then immediately there's a breakout so that you get to practically address challenges and then have issues that arise getting addressed. So learning is consolidated.
Brief lectures are interspersed with small group work where participants are taken on a journey, starting with the labour ward environment, prioritisation and decision-making tools, obtaining informed consent for surgery, anaesthetic and surgical preparation, including the use of the WHO Safe Surgical Checklist, safe anaesthesia, and evidence-based surgical techniques for normal and more difficult caesareans. In many settings, rates of assisted vaginal delivery are low and staff lack confidence to attempt the procedure, so an entire day is devoted to in-depth training for assisted vaginal delivery using the vacuum extractor.
Now be careful to maintain the angle exactly perpendicular. Do you get me?
Yes.
Okay, good.
This is definitely a very useful add-on and really refines some of the skills that we cover a bit briefly during the basic EOC course. For example, vacuum would be a whole day training with a lot of tips on how to improve accuracy and success in the procedure.
Prevention, recognition and management of 3rd and 4th degree tears is key to reducing maternal morbidity, and participants benefit from hands-on training using high-fidelity models. Key to post-operative care is careful observation of vital signs, and participants learn how to monitor these using an early warning scoring system that leads to earlier detections of complications and hence improved outcomes.
Meals, that's amazingly a new thing to me. If we had such a tool in a hospital, I'm sure, 100% sure, we're going to reduce the number of morbidities in this hospital. Even the patient care is going to improve. And I'm going to take that meals as my number one thing to make sure it is being implemented in this hospital.
Rose, show us how.
On 2 days, obstetric providers are joined by anaesthetists, enabling the two groups to better appreciate each other's challenges in care provision, leading to enhanced teamwork.
As an anesthetist, I never knew about obstetric, emergency and neonatal care. I didn't see the role until I came here, and I think I've not left this place the same. It's good.
Keep pushing.
Yeah.
Anaesthetists have an additional day of dedicated in-depth training on the management of anaesthetic complications.
And lift up the epiglottis. Yeah.
The course concludes with small groups working together to produce smart action plans, prioritising the changes they intend to put into place in their facilities following training.
We've gotten like a stepping stone to start changing things in this hospital.
So I'm very happy.
This will translate into better care for the patients because we are being taught along internationally recognized best practice standards, and if we hold ourselves accountable to that and do it consistently, enough times, enough people will have change.
I expected to come up with new skills, but the magnitude and the numbers of skills which I expected to come out with is overwhelmingly more than what I expected. I've really learned, and say to so, I can say this is the best training I've ever had in my life. Best.